So this is a few hours after my gallbladder surgery. I have to walk really, really slow because it hurts really, really bad. You got to remember they're in there lifting your liver up. They're burning and soldering off things, and they're putting a scope in you, and yeah, I can barely walk, but I'm so excited to see what my life is going to be like whenever I get done with the healing process. And hang on, let me turn on some lights here. My husband already went to bed because that poor man had no sleep whatsoever. And so I'm trying to get me something to drink. So I got to turn on the lights. And I just walk really, really, really slow. And it kind of feels like somebody beat me up. And also I can't breathe real deep. And it also feels like, what do you call it? A lot of pressure, like from the incisions and stuff. And it feels like as if you work out your abs, and then your abs are like real sore and sensitive. That's the only way I can kind of explain it. It's very, very hard to explain. But they say that the more that you try to move around, the more that you, I'm getting me some coffee, the more that you will heal faster. If you just lay all the time, it's going to be a longer process. And I'm not one of those people that want to lay all the time because, first of all, my symptoms was I felt like I had indigestion every time I would eat a spicy food like a garlic or this kind of food, Mediterranean, mainly like Mediterranean 7-spice, where it has pepper and clove and cumin and nutmeg. Every time I put that on something, I would like really be up all night long, hurting and feeling like I had, it felt a lot like indigestion. And so my doctor, at first, he thought that I had alpha-gal syndrome. And alpha-gal syndrome is a thing where that you almost are allergic to everything, and almost everything. So I stopped eating everything until we got the test back. And then when we got the test back, they said, no, you don't have alpha-gal syndrome. And so my doctor was very good with me. He tried indigestion medicine, and that didn't work. I would drink, I make my own vanilla right here all you do is just put vodka in it. I made this like 7 or 8 months ago, and then you put vanilla beans in it. And I would put, like a teaspoon of a teaspoon of the vanilla in some hot water with some lemon and some honey. And it would kind of soothe it, but then it would come right back, and it'd be more like a burning, cramping, aching. How do I explain it? I'm trying to explain it the best way I can, but it went on for 8 months. I didn't even know, like, I thought that, because it radiates through your back too, and I thought that maybe it was, my kidneys were messed up, or just different things, and they never really go with the gallbladder. Well, finally my doctor was like, we need to get you scheduled for an ultrasound, and then I bet you're going to have it removed. Well, it took 4 months, almost 4 months to get an ultrasound, and I couldn't wait no longer. It was 9 days before the ultrasound, and I had started running diarrhea. I didn't run fever, but my heart, what do you call it? Not my heart, but my blood pressure was down. It went to 99 to 42, or 99 to 64, and then it went 90 to 42, and a lot of people will die on the table if they have too much narcotics, because they will fill you. They did me. They put 7 different antibiotics in me until it was time to go have surgery. You can't have anything to eat or drink. I didn't have anything to eat or drink for over 24 hours. They did, however, when they got me in the room, they let me have 2 coffees and 2 chicken broth, because I was so thirsty and I was so hungry. But I really couldn't eat anyway. And every time I would eat, I would just hurt. And so they took me in, they did an ultrasound. And then the doctor came in and he goes, well, you have a whole lot of gallstones. And we can't just take them out because, like, your gallbladder is gnarly. It's not producing, it's not working. And whenever the gallstone gets in the tract to try to release the bile or whatever, then that's when the pain is severe. It is so severe. And it's like a gallbladder attack or something. It's definitely not my doctor's fault because he really, really tried. The system sometimes can't get you in for 4 to 5 months. And so the other day, Tuesday, I went to lay in my bed. I couldn't lay on my right side. I couldn't lay on my back. I couldn't lay on my left side. And I couldn't go to sleep. And I'd already been up past 24 hours. And I was exhausted. And then all of a sudden, I seen pictures in my head that my gallbladder exploded. And it scared me half to death. I don't know if you ever see premonitions of stuff, but I do. And I really try to go with my gut feeling now that when they're so vivid like that. And so I text my husband and I said, when you get off work, can you take me to the urgency care? Well, actually the family medical walk-in clinic. And he said, yeah. And so then he called me and he said, no, I'm on my way now. And this was like at 2 o'clock in the afternoon. And he said, I'm going to take you because you've been hurting for so long. I'm not letting you go by yourself. And there was no way I could drive. I was just in too much pain. And if you want to know the truth, it kind of feels like you're not going to make it. The pain is just as severe kind of as labor because it radiates around your back and everything. And that's what, and now everybody has pain differently. I'm just saying what mine felt like. And then at first I was scared to blog this because I was like, well, I don't want people to make fun of me, but you wouldn't believe that I had no one to turn to really. And when I would say my stomach hurt and stuff, like, people didn't give me no advice that it might be my gallbladder, except me whenever I had that premonition. And the doctor, when 4 months ago, he scheduled the ultrasound. So the ultrasound was supposed to be on the 10th, and when he scheduled it, he said, I bet you that I'm going to get your gallbladder test back and we're going to send you over to the hospital and have it removed. And I was like, oh, Lord be, and I got really scared. So I don't go to the hospital unless I'm truly, truly, truly on my deathbed. I will endure the pain, and it's also a pain that comes and goes. I want to explain that too. It comes and goes. It doesn't stay constant, but this was staying constant. There was no relief with no Myadol. I can't take Tylenol. But no relief with no Myadol. No relief with the vanilla, no relief with probiotics, no relief with not eating, no relief with not drinking. It just, and when I saw those pictures, I was just like, what if I laid here and it exploded, and then my husband comes home and I'm not here no more because I didn't go to the hospital? Because my doctor did say, if it gets worse, Betty, I want you to go to the hospital. So, I'm trying to think of everything right now because they do have me on pain pills. I don't take pain pills, so I also have a brain injury, so sometimes I can't articulate what I really want to say or how I want things to come out. So I'm trying my best here. And this is for anyone that's having, like, they feel like indigestion pains, or they feel like an adult aching pain, like right under your breast, right here. It's like right under your breast cavity, and then it goes down, like at the side right there. And it's underneath your liver is where it's located. And I didn't know that either until I got the surgery. So back to I'm jumping around everywhere. I'm so sorry. They took me down right away and they did the surgery, or not the surgery. They did ultrasound, and then they came in about 15 minutes later. A new doctor came in, a surgeon, and he said, well, your gallbladder is full of stones, almost to the rim, and it's blocking everything, and that's why you're having so much pain. So we're going to have to remove your gallbladder. And I said, are you doing it tonight? Because they were discussing if it came out bad, they were going to do it tonight. And he said, no, we're not going to do it tonight, but you're going to stay the night, and then we're going to do it in the morning. And I think he said we have one patient ahead of you. Mind you, I was kind of mad because I didn't bring a change of clothes. I had my pajamas on, which was fine, but I'm a cigarette smoker, and so I wasn't prepared that in my mind I was going to be there, and they won't give you a nicotine patch because they say that nicotine stops the healing, which they do say that for everything, but I'm a smoker. And but I will tell you this, as I was there and I was in so much pain, and then I got up to my room and they gave me Toradol first. That really didn't do nothing, just like when you have Toradol and you're having a baby, it's the same difference. You don't feel no different. The pain is still there. And then I got up to my room, finally. I waited for a room for 2.5 hours. I got up to my room, and it was freezing cold, so they gave me some warm blankets. And then they came in, and they had already put IV in me when I very first got there. And I'd already went through one saline thing, and so they came in and they put like 7 or 8 different antibiotics. They even had to put magnesium because my magnesium level was at 1.5, so I didn't have a good magnesium level. Now, one thing that kept showing up in my test was the bad cholesterol in my blood system. And so my doctor put me on, I don't know what it's called, rosuvastatin, something like that. And I only took it for 3 days, but I think now that they got this gallbladder out, this is just my thought, my cholesterol is going to go back to normal because I don't even eat fatty foods and stuff like that. I eat pretty healthy because I thought at one point I had alpha-gal syndrome. And that means you're pretty much allergic to everything in the whole entire world. And it feels like it anyway. You have to change everything. But then that came out negative. So when I got up there, they put me on like 7 different antibiotics because you need to be full of antibiotics and get that started and in your bloodstream, because you got to remember they're opening you up. They're cutting they're cutting an organ out of your body. And then after that, they gave me magnesium, and they came in about every 2 hours, just giving different bags of stuff. They would tell me, but I don't really remember, because then they would come in and give me a pain pill and give me a muscle relaxer, and I didn't sleep all night. At one point, I think I dozed off and I drooled in my hair, and then I woke right up. So I didn't sleep very well, and I'm still not sleeping. It's 10:58 p.m. right now, and I'm sitting in my office because I went and got me some coffee, like I said, and coffee's okay because they gave me 2 cups last night with my chicken broth, and I'm sorry if you can hear me swallow. But anyway, I'm gonna put this up here for just a second. Give me just a second here. I don't want to hold this phone anymore. It's hurting. Anyway, so I there's 4 incisions, but there's a really big one right here, because they said they was gonna do 1 inch like this, and they ended up doing 2.5 because my gallbladder was so swollen and full of gallstones that it was gnarly. They said it was gnarly, and they said it would have exploded inside of me if I had waited till the 10th, because it couldn't handle it anymore. It was blocking off everything, so the bile couldn't get out and digest better, good enough. And so then I watched the clock all night long, because I had remembered they said that at 9 a.m. I'd be going to get surgery. So I watched the clock all night, and I text my daughters and let them know. And then they said prayers for me on the phone, which was so amazing. And then I texted a few friends on here that I consider friends. Then it was like 8 or 7:30. The surgeon came in. I'm having those pains again. Hang on. And he said that, we're going to take your gallbladder out, blah, blah, blah. Explained everything with it, and even told my husband. Now, mind you, my husband stayed with me the whole entire time, except for an hour. He came home, got a change of clothes, fed our dog, made sure she was comfortable, her couch, her blankie, her food, her puppy pad, and a big playpen that we have in the living room. And usually when I'm gone or something, she won't eat. So I knew that she probably just would sleep. Now, he said he did tell her, because he came back without me, and he told her that Mommy was sick and Mommy's got to have surgery. And he said that she cried the whole time he was leaving, which broke his little heart. So he came back up there very quickly. And at that time, I'd just gotten in my room. And it's really strange, because labor and delivery used to be on the 8th floor. And I was in room 805. And 805 is where I had my daughter, Shaylin. And my other daughter's name is Madison. And my nurse's name was Madison. and she was about the same age as my daughter, and so it was kind of like a deja vu type of thing, kind of different. The nurses were so amazing. They treated me so much respect. They totally understood I was a smoker, but they couldn't give me a patch, and I understood it. And after like 2 or 3 hours, I didn't even think about a cigarette or nothing. I was in so much pain, I couldn't even think about it. And now, mind you, when I got out, I definitely lit up a cigarette, but still, I'm not really smoking that much, to be honest with you, because I'm still in a lot of pain, but it's a different pain. This pain is like they legitimately go inside of you, and they they pull your liver up, they cut it off, cut your gallbladder off, and then they, cork it, like this to snap it so that no bile comes out when they cut it. And then they take it out through that hole, and the hole right here, they took it out up here. I've seen some doctors be taking it out of the stomach, but this particular surgeon took it out up here. And I feel like kind of like someone just ripped my insides out, and I believe that's kind of what happened. Like they moved everything around, and plus I had a scope down my throat with a picture or a camera. That's the way that they do it. They call it I think it's a laparoscopic cholecystectomy, and it's for bad cholecystitis, and that's what I had, was cholecystitis. And it wasn't even the color it was supposed to be. It was an ugly color because I guess it got so infected and filled up with so much gallstones. And they came and got me. They took all my jewelry off. I couldn't even have earrings in, or my nose piercing, or nothing. So hubby took all that, and then he went in the waiting room, and then they took me to the and I should have recorded, but I was just so out of it, and I just didn't even think really to vlog it, so maybe it could help people. But now that I've had it done, I'm actually researching it and seeing like what they did with me. And I'm going to do a few reaction videos to kind of show you. And everybody gets it done differently. It just depends on how bad it is, or whatever, or what surgeon it is. Some will cut you all the way across, and then almost like a C-section, and then they'll staple it. Or some will do the little ones like me, and they'll still staple it. But I was lucky, my doctor did dissolving stitches, so he said like within 2 weeks they should all dissolve, and I don't think I'm gonna have much scarring, unless it's this bigger one, but I think over time it's gonna shrink down. And also, this side's not supposed to hurt, but this side hurts as well. So like my whole insides are just hurting real bad. And I started getting scared in the operating room that like maybe I might not make it because of the premonition that I had, and it's showing me pictures that my gallbladder busted inside of me. So then on the way down, she was giving me this anti-anxiety medicine. But then they put me on the table, I remember, and they strapped a belt across my hips, like a seat belt. And then they put my head in like this pillow thing where your head goes down, and then it like holds your head still. I remember it was purple. And then all of a sudden I heard, "Betty, I want you to go to your happy place." And so I listen to Stephen Dalton at night when I go to sleep. If ever you have a hard time going to sleep, he's from Ireland, and he is amazing. And he will put, I mean, I go right to sleep like within 10-15 minutes of listening to him, because he takes you to another world that's very safe and calming. It calms your mind. And I mean, I'm a hard person to sleep too, and out I go. Then I woke up and it was a nurse, and she's like, Betty, you're all done. Oh, you talk about pain. I was like, I felt somebody beat my stomach up. I thought that they had just went around just punching my ribs, my intestines, my liver, my everything. I just felt like I got beat up. Or if I did ab crunches or something, you know, to where your muscles are not used to it. And so she immediately gave me pain medicine. I don't know what it was. Oh, yes, I do. Dilaudid, I think it was, through my IV. It really didn't seem to calm it down much. But then when I got in the room, they brought me, I think, 5 milligram of oxycodone. And they also were giving me Tylenol with codone, because they couldn't give me, the night before, they couldn't give me the pain meds because my blood pressure was 99 over 64, or it'd be 90 over 60 or something. It was really bringing my blood pressure down. Now I know whenever I'm sick and I hurt and I'm in a lot of pain, my blood pressure will go down. I was very talkative. I'm a very talkative person, especially when you're on stuff, you know, and you can't feel it as much once you start, you know, taking the medication. Now, normally I can't take Tylenol because of what happened to me, and that's another story I've talked about. But these were 2 round white pills, and they didn't bother me, but they didn't give me a lot of them. I think they only came in twice during a 9 or 10 hour period and gave it to me. So it won't affect my liver or anything like that. And then they were going to keep me another day, and I was like, no, can I please go home? And this was in, after I'd had my surgery. This is with the woman that's watching me. And she goes, yeah, you can go home. We're going to take you to your room, and then we're going to let you eat something and go to the bathroom, and then you'll probably go home around noon or 1 o'clock. And I was like, okay, that's great. I'm so excited. Like, I want to go home. And then I got into my room, and then they kept bringing stuff to make sure the pain was tolerable. And I met a girl next door to me named Julie, and she had stones in her kidneys, and she had a procedure where they went in and they broke all the stones up, and so she was in a lot of pain. They didn't remove nothing. They broke the stones up so they could pass through on her kidneys. And then while I was being rolled down to my room, the orderly or the RN said that the week before I wouldn't even have gotten a room because there was people in there with stomach issues and all the beds were full. So hallelujah, I just bared through the pain, and I just said, no, I'm not going to go, because at one point I thought about going. And I'm glad I didn't, because I wouldn't have got a bed. I just would have been in that. You ever been to the doctor's office where it's a hard thing, and usually they have stirrups and stuff? You kind of know what I'm talking about. You can't lay on that for nothing. You can't get comfortable. Well, I was in there for 6.5 hours, but I'm going back to my room, my actual room now. and actually after surgery. I'm bouncing all around because my mind is bouncing, so I apologize. I ate a little bit, and they did try to keep me out of pain, and the nurses were fantastic. My surgeon was fantastic. I think it was an hour and a half I was in there in surgery, and then he came out and he talked to my husband, and he told him everything went well, and you know that I would be up in the room shortly after, you know, they watch me. And you know, if you've had surgery, they got to watch your vitals, they got to give you certain medicines, you know, so that, because you just wake up. My throat hurts because they put something down my throat. I don't know if they put me on life support. I don't know what they did, but I asked them about it, and they said that yes, they put something down my throat. So I don't know what it was. I didn't even ask. I just said my throat's scratchy and it hurts. And they said, yeah, they had something down my throat. So then I kept saying, can I go home? Now, in between this time, I think I messaged on my post in YouTube to let everybody know that I'm okay and everything went swell, because I was watching some of these shows, and a guy went in for you know, the same thing as me, and he died on the table, and it was because the opiates got his blood pressure too low and they couldn't bring him back. So it is a very dangerous surgery. It's not nothing that's simple and easy. It's very, very dangerous, and you got to remember, if it's under the liver, your liver is your most vital organ in your body, and so you got to be so very careful as to you know, how you maneuver in there and stuff. Oh, anyway, so I kept asking, can I go home? And it was like 2:30, and they came back in after they checked my vitals, and they were like, okay, you can go home now. I was never so happy in all my life. Oh, and let me back up. I went in with my pajamas on and my slide shoes, and they let me wear that the whole night until they came and got me, and then they put me in a hospital gown. And I thought that was so cool of them, that I didn't have to sleep or be in a hospital gown, getting up many times to go pee because they're filling me full of liquids. I went in weighing 64.8, and I came out weighing 68.4. So I gained 4 pounds of fluid. They weighed me again after surgery, and then I was still 68.4, but they said